Good morning, good afternoon, everyone. Welcome to day 2 of Constellations. I'm really happy this morning to be joined with two incredible actors, activists, advocates, all of the above from the Philippines, to have a conversation about what's happening there, as we're all obviously following it very closely in international news. It's been all on our minds for a number of years. Obviously, just by way of background, the Philippines has been characterized by a very violent war on drugs since 2016, accompanied by deterioration of the rule of law, progressive militarization, harassment of human rights defenders. It's been a very difficult environment. And I think we've all watched together in horror, as in particular the violent anti-drug operations have resulted in thousands and thousands of extrajudicial killings. You know, sometimes these killings, and initially they were very much justified as self-defense, but a clear pattern emerged and is still ongoing, where police officers of vigilantes employ excessive force and kill people using the justification of the war on drugs, and problematically on every level, but problematically and particularly is the killings disproportionately occur in impoverished areas and are almost invariably met with impunity. So with the climate of terror ongoing in the Philippines, it's really difficult to determine the exact number of people that have been killed. The most conservative figures from the government data suggest that since July 2016, 8,663 people have been killed. But journalists, NGOs, and academics report that by March 2019, up to 30,000 people had been killed. And the extrajudicial killings are just the most egregious and violent symptom of the war on drugs. There's also institutionalized all-round attacks on people who use drugs in their communities, surveillance, false testing and treatment, denial of harm reduction, and denial of evidence-based treatment, and over-incarceration. Like, the prisons in the Philippines are full. The crisis has received a lot of international attention as well by the International Criminal Court, the UN Human Rights Council, a resolution of the Human Rights Council and the creation of a UN joint program on the Philippines, one objective of which is to promote a rights-based approach to drug control, and the reports of the highest UN representative of human rights, the UN High Commissioner. All ongoing processes. However, the recent attention raised by the report of the UN High Commissioner, the elections in the Philippines in May 2022, resulting in the end of President Duterte's regime and the installation of Ferdinand Marcos Jr., I think raised interest amongst us in the international community as to whether this was a turning point for the Philippines. But the fact that extrajudicial killings have continued throughout 2022, including during the presidency of Ferdinand Marcos Jr., and the fact that Marcos has just appointed a new chair of the Commission on Human Rights, doesn't seem overly concerned with the situation of human rights in the country, begins to sap our faint hopes. And so in that context, we are really fortunate to have Kathy and Panky with us today. Kathy Alvarez is the executive director and one of the founders of Street Law PH, a legal services NGO working on drug policy reform in the Philippines. Kathy and her team provide paralegal skills training for communities and persons deprived of liberty as part of their work on access to justice. Panky Nadella is the founder and executive director of IDUCAM, the sole organization in Cebu City catering to the health needs of people who use drugs. Since 2013, Panky has been an active drug user rights advocate focusing on access to harm reduction services and decriminalizing drug use in the Philippines. So Panky, if it's okay with you, why don't you start by giving us some of the backstory, tell us about the successes of IDUCare and your achievements over the years.
Hi, Naomi. IDUCare is a community-based organization started in 2015, actually, before war. The Duterte's administration, community-based organization serving. We started in service delivery and HIV. So yes, we are outreach worker reaching out to the drug user community and others, and also the 30th administration 2000 2016, and luckily we have a community center at the time also. So it's a coincidence also that we have a community. We run the community center, and we're doing this that of drug users like their health, HIV, hepatitis C. It's like we're doing a safe space for them to talk about health and others. And sometimes the safe space, like because of the war on drugs, so about that, so issue of our safety because we are also drug users community, so we try to, so how does that's the big challenge, how do we safely safely going out reach a war on drugs, it's not already safe anymore. So at that time we're so do we have to stop or not? So if we stop, there will be dead also with through health or through. So yeah, we plan to continue serving, just serving the with the team, continue serving the community, drug user community until for 5 years now we still here and still serving. So maybe we can do some uh, success story of how what we are doing. So not just the war on drugs, we experience also the pandemic. So we just still continue serving the drug user. The concept of the community space is that they can go there what they want, and they can they can choose whatever menu of service. So there are a lot of menu of service of the community centers, HI disease treatment, motivational interviewing, and others like social support and something. And during the lockdowns, we also so that we upgraded a service because we are locked down. So we do a social media infographics, helpline. During the we were able during the pandemic, let's say after 250 drug users for one month of supply. We call it food packs, but of services. And yeah, during Typhoon Odette, that's also our challenges also, but they're still there. They're serving, and one of their highlights also is that we already the women who use drugs already as also, and they are trained now as together with the training as paralegal help, uh, paralegal. Together with street law, we expanded our services through the jails, in the jails, mga people deprived from liberty, especially there. And hopefully, we will expand our service together with street law and jail officers. Hopefully, we will be agreeing, and we will do the helping as part of extra services of the. Not now we are not just health, harm reduction, and also we're doing also the women who use drugs. So what more? There are lots of success story already. They have lots of compliments and compliment. Now we are also engaging the barangays. Hopefully, I don't know how to explain barangays. It's a small unit of the city here in Barangay. Now we doing we are all now inviting for yeah, how do you can drug council, drug AIDS council, something like, I don't know the acronym of the BADAC, but the barangay's official local government, and monthly BADAC, and talking to them about the drug user concerns and the workers. And we do also do harm reduction, let's say, to the community, so yeah, and services.
Thanks. When you go and speak to the barangay, the local government, about harm reduction, is it new information that you're providing when you explain harm reduction and the complex range of social and health issues that you need to take into account? How do they receive the information you're giving them?
First, together with the street law they facilitated, we conduct we invite them for a one big. We invited around 25 barangay officials, barangay captains, or barangay like the, and we had uh, the title of the workshop is the role of the barangay, uh, the role of the barangay in harm reduction. Uh, Something like the role of entitled. And we had an activity, and they roll out their they roll out about this, where we get this is we scope. Also, aside from that, so we barangay also officials are new about harm reduction. So now we have a follow up activity after that. They first they have we have one activity in that covenant signing. So we did a covenant signing. Happily, they are
Okay, so we'll come back to Panky and the covenant. I think he was experiencing some Wi-Fi connections there. Kathy, obviously, you work closely with Panky and IDU Care at Street Law PH. I'd love to hear a little bit from you, and I think everybody with us today at Constellations, love to hear from you about the updates, any of the particular work that Street Law is doing that you'd like to prioritize. But yeah.
Hello, thank you, Naomi. Hi, everyone. As Panky was saying, we worked with them, care in facilitating some of the activities with local government, including the barangays, including the covenant signing that Panky just mentioned. Basically, in the covenant, it's just a way for us to introduce the barangays to idea of harm reduction, to the idea of non-violence, basically, because for the past 6 years, the barangays have been involved in so many of the different practices of law enforcement that created that facilitated violations of human rights, including surveillance, listing of people who are suspected to be involved in drugs and things like that. And we wanted to have a space where we could present that doesn't have to be like this, that there are other ways to go about the issue of drugs. But the limitation is that despite the change in the presidency, I think it's important to remember that our punitive laws remain in force. And so it's these punitive laws that basically provided legal cover for all of the human rights violations that you mentioned, Naomi, including the killings. And although the term has ended, these laws that call for punitive treatment of people who use drugs are still there, and they're still used by law enforcement to arrest people. And during arrest, there have been so many documented issues as well of rights violations. And yes, recently there are developments, including joint program with the UN. So the joint program is between different agencies of the United Nations with the Philippine government, which was launched July last year. And this is a response to the Human Rights Council report on the human rights situation in the Philippines. It has been in effect, so to speak, in the Philippines for over a year, but sadly, we feel that there is a need to maximize these opportunities more. There are efforts now being started just recently to include civil society and communities in the activities in relation to the joint program. But these efforts have been very recent, and we're only just starting. So we're still like, in fact, Street Law PH has been asked to join the technical working group of on the component on human rights drug control, but haven't attended any meetings yet because the invitation to join was just very recent. So the way I see it is that the opportunities in the joint program are there, but there is an urgent need also to make sure that those programs listed in the joint program are not just, it's a checklist of activities that the government can comply with, but rather to make sure that it will really affect substantive change. And one of the substantive changes that needs to be done is really when it comes to drug policy Philippines. But we see some steps being taken to try to introduce changes to our laws. But we also know from our experience that it will not be quick. It will take a long time. In the meantime, it's good that IDU Care and other organizations are trying to create spaces in the local areas where harm reduction, the idea of harm reduction is introduced, the idea of human rights-based approaches to drugs is introduced, while while the national government is trying to push for changes within the joint program. But there are also some worrying developments. So on one hand, you have the joint program where the UN agencies are pushing for human rights-based approaches. On the other hand, there are attempts to introduce legislation that would institutionalize the practices that were done during the term of Duterte, including surveillance of those who are suspected to be drug users. And this surveillance will be in the anti-drug abuse councils that Panky was mentioning earlier. So there's a pending bill that seeks to make it the job of the anti-drug abuse councils in the barangays, in the different levels of government, to conduct these surveillance. And that's something that we are very trying to push back against. Well, there's also a bill trying to reintroduce the death penalty for drug-related offenses. It's something that we feel very worried about. And as I was in another meeting earlier, there are indeed circulars trying to reduce jail congestion, trying to allow for early release, but it's important to take note that in most of these circulars, there's always a provision that says, except for those charged with drug-related offenses, which doesn't make sense considering that in the jails that we visited recently, over 90% of those detained are charged with drug offenses. So basically, there are issuances coming out, but if you are charged with offense, it's like you're automatically prevented from making use of these early release mechanisms. So those are the what's happening right now in the Philippines. Maybe you'd like to ask some questions, but as of now, those are the things that we see that we are both looking forward to in terms of opportunity in the joint program, but also very worried about in terms of there's an effort to seal the Duterte legacy, something like that. And this is how it's phrased, even in the public hearings, in pushing for this legislation. Because they look at the war on drugs as a success. And this is the perspective of government. Unfortunately, this view of looking at the war on drugs as a good thing is shared by many Filipinos. So it's really a challenge also in civil society, how do we, how do we change this narrative? How do we let people see that it's really what's happening, what has happened in the past, and is continuing to happen. Um, it creates a sense of lack of trust within the community, where people are now being asked to, report on each other, and adding people to the list, instead of creating a sense of harmony and community between, we have. So the damage caused by the past 6 years, it will take a lot of undoing, a lot of effort on the part of civil society, in the part of community organizations, to try to undo that. And so, and I always ask, like, how do we deal with law enforcement that's been given so much power the past 6 years? How do we reverse that with the generations of police officers that are now under training? So these are the things that we have to work very hard on, and have to survive, basically. It's really a marathon, and we need to build our strength, build our communities, and build solidarity with international organizations to learn from your experiences. Uh, because it looks like it's going to be a long fight ahead of us, despite the end of the presidency of Duterte. Thank you, Naomi. And I hope I didn't end on too hopeless note. I think the fact that IDU care exists, that street law exists, is also something to worth celebrating. In a way, the fact that there are some organizations that didn't exist before, are now here trying to work for harm reduction, trying to work for human rights in the context of it's something that I think still should give hope. Thank you, Naomi.
Yeah. Thanks, Kathy. I really agree. I think the work and the fact that street law, PH, and IDU care exist are really worth celebrating. I have so many kind of interesting segue points and questions off all of that fantastic information you were providing. Maybe just one thing to pause on that might be interesting to everybody with us at Constellations is, when you're trying to kind of change the mindsets of people, if you think about at barangay level or at central government level, the war on drugs has been so pervasive and there's been so much violence. Like, there couldn't be a single person left in urban areas that hasn't witnessed the violent policing and the violent extrajudicial killings and the tactics. Even if their family hasn't been affected, they must have witnessed that violence. And so when you think about this idea that there's a notion to kind of hold on to or preserve the legacy of Duterte, where do you think this is coming from? People must see that this is not the society they had before. This is not the country or the cities that they want to live in.
Unfortunately, Naomi, there has been a lot of success on the part of, well, this approach where violence and shortcuts are seen as the immediate answer to what people see as problems. And it hasn't social media misinformation has also played a very important role in keeping this attitude, this way of thinking, that it's okay for those who were killed. It's okay because they were criminals. It's okay because they caused danger to society. And I think it also speaks of the very deep stigma in the Philippines, and I'm sure in other areas, when it comes to drugs and drug use. And I think this is where the work that IDUCare is doing, barangays, plays a very important role, because we are showing that, people who use drugs are helping each other access healthcare services. They are just as human as you and me, and this is something that needs to be done in so many levels, in so many ways, because the Duterte government was been very successful in dehumanizing people who use drugs, and has, the labeling of people who use drugs as evil. This is pervasive in all aspects, in all levels of society. And so there's a very urgent need to go back to humanization, to addressing stigma, to creating spaces where the people who make decisions have a chance to interact with communities of people who use drugs on a human level, on a person to person level. And this is what we've been trying to do at Street Law as well. For instance, we've tried to organize trainings with judges and try to give them a chance to listen to people like Panky, for example, to members of the community of people who use drugs, where they hear each other not as someone who is engaged in the criminal justice system, not as someone who is in trial in their court, but as a fellow human being. Because I think that is sorely lacking. We've created so many barriers in our society, Philippines, and it's time to really chip at those walls by reminding, creating spaces, creating opportunities where people who make decisions are reminded that the decisions they make have an impact on real people's lives, and that people who use drugs are no less human than them. And I'm sorry that it sounds so basic, but it's actually not very clear in the Philippines right now because of the values that are being spread about violence, about stigma, and so it's been really a challenge for us to go back to reminding institutions about the humanity of everyone, especially communities of people who use drugs. And unfortunately, I wish Panky were able to reconnect with us so he could share their perspectives more. But in the meantime, I hope I'm not speaking over them when I say this. So we try to create spaces like this where they interact, judges, prosecutors, public defenders, jail officers, interact not as people caught within the criminal justice system, but as human beings, to try to go back to that, what do we have in common, to try to break through the stigma that the Duterte administration has been very successful in spreading all over our country. And I'm sure this is something that this is not just an experience in the Philippines. It's something that we can learn from other areas and other communities as well. I hope I was able to answer your question, Naomi.
No, absolutely. And look, I think it's something that came up in a discussion between two Americans on Constellations last night, Ricky Blumenthal and Greg Scott. And it's so depressing, but it has been one of the most effective aspects of the war on drugs propaganda, right? The idea that people who use drugs, as a result of their drug use, they lose their agency, and therefore all sorts of things are justifiable. And it's a ridiculous stretch, and yet it's something that has really pervaded kind of mainstream or a popular belief and culture. And deeply depressing. Obviously, the Philippines is an example of where it goes most wrong, when you can deny somebody their agency. I'd love to ask you a little bit more about the 3 pieces of legislation. Well, you said 2 pieces of legislation in the jail congestion. With some of the kind of opportunities or upcoming advocacy moments for Street Law PH. Obviously, you will need to strongly oppose this new legislation, which proposes ongoing or increased surveillance duties upon local councils, upon the barangay, and at other government levels. Do you have a sense of how much support this has, the legislation, or what's going to be effective to oppose it?
We attended the recent Senate hearing on these particular bills. And sadly, all of the different government agencies, of course, expressed their support. So it's really an uphill. It's not going to be easy to try to oppose these provisions. We're trying to engage by coming up with our own comments, especially since the government is now saying that they're taking the public health approach, basically co-opting the idea of a public health approach. And so we are doing our best to remind them of that this came from you, the idea that we should take on the public health approach. Your participation in the UN Joint Program, that you also have some commitments, and so this is what we're trying to put across, that based on your commitments from the UN Joint Program, based on your own declarations, that you are now going to take the public health approach when it comes to drugs. So having a surveillance system and using the barangay councils is totally opposite that. It goes opposite direction. Although, of course, we have no indications of them really being able to recognize this, Naomi, unfortunately, because they don't see the disconnect. And even the health department has expressed their support, although we were happy to note that the health department was repeating again and again the urgency of looking at the issue of drugs as a health concern and not something that should be for the criminal justice system to address. But until now, we still don't have a health secretary. The new president hasn't appointed one. The health secretary now is officer in charge, an OIC, is like an acting health secretary, and it's kind of difficult to calibrate what the Department of Health's approach will be while this department head is still, sort of temporary. So those are also the factors that are coming into how we're approaching this. But we're trying to engage with the committee, we're trying to engage with the office of the senators to try to push forward our proposals, if to be more consistent with what the government is saying, that they want to use the public health. They're seeing this as a public health issue. Then this is how. Then you should be doing surveillance. Then you shouldn't be, requiring drug testing, because that's not consistent with what you're saying. But then again, that isn't exactly known for consistency, right? So it's we have to manage our expectations.
There are very few governments that are known for consistency. I think the biggest problem with that surveillance, though, when you described it at the beginning of our talk, you said, people who are using drugs or suspected of using drugs, and along with that kind of sense of, if you use drugs, you lose your agency, you can't make decisions. That's the other kind of most nefarious reach of kind of punitive drug control in my mind. Like the idea of everybody being under suspicion, it just being this kind of shadowy territory where drug control can reach in and investigate or interrogate anything due to the suspicion of drug use. And, it's very short-sighted for so many people to be thinking this is a good idea, because inevitably it could affect them. But obviously people do not think rationally when they're looking at this sort of political, ideological stuff. The other major issue, obviously it's been on and off the table in the Philippines for a number of years now, is the idea of bringing back the death penalty for drug offences. And that would be a major step backwards for the Philippines, because it abolished the death penalty. It was, I think, the first country in Southeast Asia to abolish the death penalty years and years ago, right?
That's true. We were actually lauded as a good example years ago. We are also a signatory to the second optional protocol on the death penalty, and as far as I know, we still are a signatory, and we hope this will prevent the Philippine government from pushing forward with its calls for the reinstatement of the death penalty. It's very much linked with the dehumanization and stigma against people who use drugs, against communities, because there's this image, of people who are, how it's portrayed in media as those who are high on drugs as committing the most heinous crimes. And so this becomes a justification for the reinstatement of the death penalty as a way to prevent people from one, being involved in drugs, and two, supposedly against committing heinous crimes. Although clearly there have been numerous studies that show there's correlation at all, but as you have said, logic flies out the window, reason flies out the window when there are very, very negative portrayal, very, very dramatic portrayal, exaggerated portrayal of the impact of drugs on people who commit crimes. And this is consistent in the headlines, in the news. It's always someone who has committed a heinous crime. There's always an assumption that, oh, this person must have been high on drugs. And this is repeated in interviews of senators, in interviews of people who have occupy high positions in government, people who influence, how Philippine society thinks. And I find this to be very irresponsible on their part, but at the same time, it's a way for them to get political mileage. So it's really it's like a perfect storm of the different factors. People using the issue as a way to gain political mileage. At the same time, the deep-seated stigma on people who use drugs, which supports the calls for the reinstatement of the death penalty. Fortunately, there's also civil society group pushing very hard against this. And for the past 6 years, we were able to successfully prevent it from being reinstated during the term of Duterte. I hope that we continue to be strong and strategic with this new government.
Yeah, I hope too. Obviously, harm reduction has a long history of tracking the use of the death penalty for drug offences. And I think when staff at Harm Reduction International first started looking into this, 12, 14 years ago, the use of the death penalty for drug offences was the most egregious example, the most kind of outstanding and obvious example of the fact you could justify just about anything in the name of drug control. And then obviously 2016 rolled around and Duterte showed us that it doesn't even have to be a state-sanctioned killing, it can be killing on the street. There's a new level of horrendous and violent use of drug policy to justify state violence. So yeah, we really hope that this does not end up as a priority for the Marcos administration. And I think you can see from the comments on the side here, there are civil society and harm reductionists and academics from all around the world who've dialed in to catch up with your updates today, Kathy, and obviously Pankeys, as soon as we can get them back, that would be great. But I think obviously a question that always comes to our mind from the international space is what can we do from the outside? We've seen how some countries respond to international interference, whether it's in the form of a court or the UN. Often when it's an international gesture, it's seen as a threat to sovereignty, and it becomes a more hostile and more toxic issue. So I think everybody here would love to get your advice on how we can be useful to you in any of your actions and your advocacy.
Thank you, Naomi. I understand there's also a lot of pushback in Philippines, for example, when it comes to the ICC coming in. There's a lot of negative reaction from sitting government officials looking at it as foreign intervention. However, there are opportunities, I think, where organizations from outside of the Philippines can help. For instance, the UN Joint Program is funded by so many different European and Asian. I think, if I remember, Australia helps fund it, Korea helps fund it, as well as different member states of the EU. I think it would be helpful if those member states who are providing fund support would also seek accountability from the Philippine government, because this is your taxpayer money, your money coming into our country introducing these programs. And I think you have every right to say, to demand from your government, how is the Philippine government spending this? We have to make sure that the capacity building that's being done in the Philippines is not going to result in making it more efficient for agencies to violate human rights. And I think it's the member states from outside the Philippines can actually demand this, since it's your money, right? So I think it and it's especially important now, the way the program is designed, is that the resolution creating it from the UN Human Rights Council only requires reporting through the first year, which is this October. And after that, no formal reporting to the UN Human Rights Council is required anymore. I think it's important to push to still require the Philippine government to tell us, tell the UN agencies, tell the different member states what's happening with the UN joint program. How are you implementing all of these different components on the ground, and how is it really, creating change where it's needed? I think these are some of the opportunities where those who are outside of the Philippines, organizations, individuals, can help support us where we are. But those are
Yeah, I
just a
think that's
few.
really powerful, because if you don't have that focus from the international community, those moments where the Philippines comes up for review, the joint program will potter along. And I suppose these extra moments kind of reinforcing the international interest in the issue, support both the people implementing the joint program inside the UN and the civil society in the Philippines who are pushing for human rights.
And I think it's especially important to push the UN joint program towards really a genuine participation of communities, especially when it comes to the component on drugs and drug control. And not just some for compliance, not just a checklist that that they can say, oh, we've done this, but it's important to really push for how much are communities of people who use drugs safe enough to be able to express what they think about what's happening in the joint program. And I think it's important for agencies involved in this joint program to ensure those safe spaces, especially since the criminal laws remain the same. Communities of people who use drugs continue to be criminalized and targeted. So I think there's a very good opportunity here to push for better drug policies, to push for genuine participation of communities, and I hope the UN agencies won't waste it. So we need your help in making sure that this program, this program created in response to the Human Rights Council's report on the human rights violations in the Philippines, that it won't go to waste, that it won't end up capacitating agencies to violate human rights more efficiently. And
Yeah.
that's a challenge that we put to those of you who are outside the Philippines.
Yeah, that is a dark and very powerful phrase. Won't end up capacitating those to commit human rights violations more effectively or efficiently. Um, I think that's really clear. We cannot afford with the Philippines for this joint program to be a tick the box exercise. It needs to genuinely advance and progress human rights in the Philippines and support the Filipino leaders like yourself, who are stepping up and pushing from inside for the same objectives and the same outcomes. I think my colleague at Harm Reduction International, Giada Girelli, knows the full list of the co-sponsors to the joint program, the governments around the world which are funding the joint program to the Philippines. So we'll try and communicate that in the chat and make sure we push it out a lot on Twitter, because it will be useful for people to know, as you say, Kathy, if their government and their taxpayer dollars are funding the joint program, that we can ask for accountability through that mechanism. We can ask our government to ensure that the Philippines joint program is reviewed annually and we don't miss that opportunity. And so, Kathy, I think something that struck me earlier in the conversation, obviously, ideally, we'd have Panky here to join us. But while we had the benefit of him in the warm-up room for 30 minutes, the internet has now given out for us. When I first met you, I think in the Philippines in 2016, I think your ideas for street law PH were really just like a twinkle in the back of your brain. And then you visited the Gage Juristen in Copenhagen, right? And began to put your plans together. And obviously, you of all people, when you go in and run these paralegal programs in the prisons, when you do direct legal services, you understand that everybody, whether or not they have used drugs or been charged with a drug offense, is just another human. And it's those stories of humanizing the context in which drug use happens and the context that drug policy impacts upon. Humanizing those stories is what's really important to be able to convey. If you wanted to tell us any more about, what Street Law PH is focusing on at the moment, obviously you wear many hats, you do many different advocacy initiatives.
We sound like we're such a big organization, right? But it's only like there's only 2 of us lawyers working full time. The rest are volunteers, and we work very closely with community paralegals. What is important to us is not just the transfer of legal knowledge from our part, but also to make sure that the expertise of people who use drugs are amplified, especially in community in countries like ours where there's really hesitation because of the criminalized nature of our communities, the communities that we work with. We have to make sure that the spaces are safe, where we are able to allow, to give them space to express how they feel about certain policies, how they feel about certain regulations, and what we can do about it together. I think over the past years, we've learned at Street Law PH to, and this is something that we share with law students who intern with us, with lawyers who volunteer with us. We may know the law, but the real experts here are the people who use drugs, because their lived experiences should be leading the way, and we should only just be supporting. And this is where Panky and IDU Care and Orange Cap and all of the different organizations come in. But it's, as you can see, it's also quite challenging in the Philippines to make sure that the participation of communities of people who use drugs are genuinely meaningful. We're always very cautious that we're not speaking over the communities that we work with. Is something that we're very careful about, but at the same time making sure that they're not targeted because of the activities that we do together. And I always joke about this, that it's exhausting always having to look over your shoulder, but it's also the reality, that we were really looking forward with the end of the Turkish regime for there to be a little bit more breathing space, but it looks like we have to keep, hold our breaths for a little while longer. And so we get hope from the experiences of other people, other countries, where we see that at the end of the very dark tunnel, there's some light that can be seen. And so it's something that we are thankful for spaces like this, for HRI organizing events like this, where we are able to share what's happening here. And I think I just want to make sure that it's very clear that just because Duterte isn't president anymore, it doesn't mean that things are better. And I hope the international community won't drop the ball, so to speak, that you won't look away, because we know we compete with so many different issues that are happening all over the world, that the Philippines, what's happening in the Philippines is coming up in a world where, there's so much violence, so many human rights violations, so many attacks on different levels. So I hope we won't be pushed back down on the list of those that need your attention and your support, because things may seem okay on the surface, but those of us who are working on the ground know that it hasn't really improved. Things haven't improved. There's still a lot of work that needs to be done. For instance, I would love to see the day where you won't be talking to me anymore, because you'll be able to talk freely to communities of people who use drugs, to women who use drugs, without them having to be afraid of showing their faces, right? I mean, that's the goal. That's what we look forward to, where Street Law PH can really work in the background, because those who are in the communities can start speaking up for themselves freely and without fear. But until then, we are here to try to help as much as we can. But we also
Thank
learn
you.
from you. We also learn from HRI. We learn from all of the different organizations. We learned so much from our experience with Gadeoristen, with Nana, with the communities in Copenhagen. Although the context is very different, what remains is common is that we do not use humanity just because we choose what substances to put on our body. It shouldn't matter. The law shouldn't treat us any differently. Unfortunately, the Philippines always comes out as the worst example of how people can judge for the decisions that they make for themselves. And so I don't know when it will happen. Maybe if you talk to me 10 years from now, I hope I will be able to say, oh, it's okay. You don't have to. I don't have to talk. We can ask someone from the women's community to share their stories without having to be afraid of being targeted, of being arrested, because things have improved, and that the
That
Philippines
is an
won't be the
amazing goal.
right. Imagine if that happens, and then we will have to always talk as the worst examples
Yeah,
of the most egregious human rights violations in the name of drug control anymore. I think that would be awesome, right? I mean, if
yeah,
instead of the lawyers coming and talking, it's really people from the community who could take the stand and be able to share. I think that's
amazing. Yeah.
our ambition.
I think that is a really great ambition to have. And so you can see in the chat there, the HRI conference team has said if you have any questions, we have about 9 minutes left. Please post them in the chat, and Kathy can examine them. At this point, I understand that with Panky's access to internet, it's unlikely he'll be able to return to us, which is really disappointing. But at least we got a little bit of the story of IDU Care and their success. With the health clinic delivering services, forming a connecting point for people during the COVID-19 pandemic. And you can also see in the chat that Jada Girelli has written that the UN Joint Programme focused on the Philippines is funded by Ireland, South Korea, Australia, Germany, Norway, and the Netherlands. So if you are watching and you're a citizen of any of those countries, you should reach out to your government and make sure they're accountable for the UN Joint Programme, really genuinely focusing on human rights and genuinely offering space for communities to participate. And then, Kathy, if I can squeeze one last question in while we offer this space to the community and hope against hope that Panky's Wi-Fi returns. So obviously you have the vast support of everybody in the international drug policy reform and harm reduction communities. There is so much interest in the work you're doing, and the courage it takes you every day to get out of bed and speak out in these really, really difficult times. I'd be super interested to hear your reflections on how it goes with national human rights organizations in the Philippines, not those in HIV and health and drug policy, but those who come from a human rights background. Because obviously, 3 decades ago, the Philippines had a really, really robust human rights civil society. Have they stepped in to stand behind you and fight for the rights of people who use drugs and for more humane drug policy?
Okay. Actually, Naomi, before Street Law PH was formed, one of the events that pushed us to really organize ourselves into a legal service organization was we attended a consultation on the extrajudicial killing, and this was maybe 2017, like a year into the war on drugs. And we were hearing during these meetings that even human rights lawyers would say that we are willing to help the victims of the killings, but only if they were mistakenly identified as people who use drugs. And so this really was a slap to our faces to wake up that there's still a lot of work that needs to be done even within the human rights community in the Philippines when it comes to the idea of people who use drugs, the idea of drug use as not something that should be subjected to criminal penalties. The idea of, and I was really thinking, but how about the right to counsel? Isn't everyone entitled to the right to counsel regardless of their situation? And there seems to be it's like when drugs come in the picture, there's a wall immediately, even within discussions with the human rights community. I think this is a challenge for us as well. How do we expand these discussions so that it's not just Street Law PH who's talking about these things. Fortunately, have been a few opportunities for us the past few years where we've been able to share our views, although it's always met with a lot of, that's so radical. I've been called a radical lawyer many times just for saying that people who use drugs shouldn't be sent to jail. Because
Well,
unfortunately,
we celebrate that radical lawyer.
yeah. So
It's new.
it's a concept that has yet to gain traction within the Philippine human rights community. The idea that it's not jail, it's not jail isn't the answer, and there's also this it's not jail or rehab. There's also some who say, okay, they shouldn't go to people who use drugs shouldn't go to jail, but they should go to rehab. So this is something a dichotomy that we still need to break.
Yes. And the people that think that tend to think the rehab should look like a jail anyway, which is
exactly. So it's
not
like you're
really
just
progress.
changing the name, but it's still mandatory. So these are ideas that we have to constantly talk about with institutions, with people in the legal profession, with law students. I have a funny story. I always say, this past year we had law interns, and one of the law students decided that her thesis would be on decriminalization. And her past, the panel from the law school told her, why? The drug law isn't, there's nothing wrong with our drug laws. Why do you want it changed? And I think this is because legal education in the Philippines, lawyers are still trained very much to look at the law as, just because it's legal, then it should be just. And this is why it's very important to destroy this notion that, to disrupt the idea that just because it's in the law, it's automatically just. And this is also where a lot of the challenge for us comes in. Like, how do we open the eyes of people in the criminal justice institutions to see that you shouldn't have to be responsible. You don't have to make decisions for other people. I mean, why are you making decisions for people who use drugs? They should have their own agency. Fortunately, we've had some very good opportunities with some judges, some lawyers who are now helping us to openly call for changes in policy. And those are some of the good stories that we are happy to share. For example, we had this town hall in a city in Mindanao where a judge openly said, the problem is our drug law. It needs to change. We need to decriminalize. And to say that in a room full of people, with police officers, with local officials, it's like, whoa. We were like, whoa, that's amazing. So we hope to
incredible.
multiply these situations more, to create more, instances where conversations like this are being done. Sorry, I ramble on and on, Naomi. I apologize, but it's important. It's a topic that is very close to my heart.
It makes it makes a lot of sense, and I think that that is a beautiful note for us to end on. The idea that in all your work standing up courageously with Panky and others at I Do You Care, there are the beginnings of, lawyers and other judges standing up and joining your work to disrupt these very strongly held beliefs, that all drug use is bad and that all drug use must be punished, and to really rethink the policing practices, the criminal laws, the systems and structures that allow police to have so much power. That you have been successful in beginning to build a counter narrative, and a human rights team response, and people that will back you in your fight going forward. I think that brings us to the hour. We had an hour for this conversation, right? Let me just check my calendar here. And I think that since Panky can't join us, and we have hung on to the very end in the hope that he can join us, that's a beautiful note for us to end on. If you wanted to have any closing remarks for for the audience, that would be fantastic.
Thank you, Naomi, for this space. And I'm sorry. I really wish Panky were able to join us. But I hope there will be more spaces like this where we can share not just our experiences, but also our hopes and dreams for how things could be better in the Philippines. And again, I ask those of you who are watching from outside the Philippines to don't look away now. Now is not the time to look away. Now is not the time to drop the ball on what's happening in the Philippines. Continue to help and support us because we still need very much your help and support. Thank you, Naomi. Thank you, everyone.
Thank you so much, Kathy. I'll see you later.